I want to welcome everyone out there, and I'm so glad that you're listening right now. This is all about fast food in the body. We all are guilty of eating fast foods. It's very popular. Today, we have more restaurants opening up in every neighborhood among the world, even the American restaurants over in Europe and China and just everywhere around the world that fast food is acquainted with the US. Everything is like fast. The problem with fast food is that it's high fat, it's high sugar, it's high sodium, and it's no fiber. These are all big problems, all huge problems. And just a couple of things I will bring out with you regarding common symptoms that you will get from eating fast foods. And I'll go into it a little more as we progress. I'll move through it quick. Our headaches, acne, heart disease and stroke, high cholesterol, weight gain, blood sugar spikes, insulin resistance, dental problems as a result of sugar, depression, shortness of breath, even those people who are overweight, high blood pressure, extra calories, bloating, and puffiness. That sounds like a lot, guys. That's a lot. That really is a lot of problems. And I'm going to back it up. Okay, let's talk about the digestive and cardiovascular system. When we're loading up on these drinks, this fructose and these sugars, this is a serious problem. Increased sugar increases increased glucose. That increased glucose increases insulin. You're knocking on the door of insulin. Insulin is under lots of stress. The pancreas is pumping out consistent insulin. Remember, in order to gain weight, you have to have insulin. So you're always on the verge of having more insulin if you're drinking lots of sugars, and those sugars are hidden in those foods. And the problem with too much sugar is that you're eventually going to develop insulin resistance, which is potentially pre-diabetes and type 2 diabetes. That eventually can lead to metabolic syndrome. I'm not going to jump the gun so quick. So remember that when you have too much sugar, excessive sugar that's not stored as glycogen gets converted to fatty acids. These extra fats, these low density lipoproteins, develop that high cholesterol, the bad cholesterol, and the triglycerides. When you increase your low density lipoproteins, which is your bad cholesterol, and you increase your triglycerides, this is when we start getting more plaquing in the arteries, which can lead to stroke and heart attack. Then we look at sugar and fats. There's so much. We look at people eating pastries and pizza doughs and crackers and cookies. I mean, everywhere you go, this is what people are eating. This is the fast food. It's loaded with sugar. There's no fiber. The purpose of fiber is it slows down the assimilation. It prevents the spiking of glucose and the surge of insulin. And when we have more fiber, which is not in these fast foods, this is what's going to lead to these potential metabolic problems. And it's going to lead to a lack of satiety. You're going to crave more sugar. Sugar is a drug. Sugar is inflammatory. It's going to have tons of sodium, people. Tons of sodium. This sodium is hidden because when I ask people out there, you're eating too much salt. I don't add salt. Well, if you're eating fast food, you're getting so much salt, and eating high salt amounts is going to lead to extra retention of fluid, water retention, which will lead to puffiness, swollen ankles, bloatiness, which means increased high blood pressure, increased problems on the heart, cardiovascular problems, that bloatiness. Your respiratory system, it shows that even children who are eating lots of sugar, this is commonly can more develop into asthma, just the sugar in itself. If you are just overweight, this can affect your respiratory system as well. It can give you more shortness of breath, difficulty walking, climbing the stairs. This has an effect on your central nervous system. This can lead to depression. It can affect your reproductive system. It can affect your skin. Remember, excessive sugar is toxic when it comes to producing collagen. It kind of takes collagen and kind of beats it up. Okay, it just beats up your system for you trying to get subtle, soft, healthy skin. You know, we used to think that it was the fried foods that caused acne in the past. It's not. All right, studies are out there today. It's showing excessive sugars. The inflammatory amount of sugars is what's leading to the acne. So if you have acne and you're getting treatment for acne and you're not changing your diet, you continue those excessive sugars, you're going to have problems. We also have found that people that have these excessive sugars from these fast foods, this is linked to obviously more obesity because increased sugar obviously is going to put more fat on your body. It's not so much the fat that's causing the fat. It's the increased sugar that's converted into fat in the low density lipoproteins as well as your triglycerides. But the fat that you're getting is around the visceral. we call it visceral fat. That's around the liver, the stomach, the gallbladder, all those important organs. And this is linked to metabolic syndrome. Okay, high blood pressure, diabetes, autoimmune problems. Remember that when you're sick, you got to look back inside. You got to look at the gut. Now, the problem with too much sugar is it throws the flora off, it throws the microbiome off of our large intestine. So, therefore, the probiotics are being eaten up by the Candida albicans, which is the poor bacteria that can eventually lead to yeast infections in females as well as males. Females are more symptomatic, but it could be transferred. But the bottom line is, remember, when your gut, your microbiome is weakened, it affects your immune system. So people who have lupus, rheumatoid, and other diseases, I'm telling you, diet is so important. It can really strengthen your immune system. It can really help you become stronger and healthier and heal much quicker. We've also found that as a result of the excessive sugars of these fast foods, the excessive sugars we found increases the likelihood of being more obese. And the research shows that, we talked about this the other day, is that more obese people store more vitamin D in the fat, because vitamin D is fat soluble rather than circulating in your bloodstream into the organs that need that vitamin D to do its metabolic functions, because vitamin D is a steroid. Works like a steroid, but it has so many different metabolic functions, particularly the immune system, that the majority of people, particularly in hospitals who got COVID, they found that the majority, 85% of them, all had low vitamin D levels. There's other low levels as well. But the point being made here is that if you are more obese, you need more vitamin D, okay? And need to get your blood levels checked when it comes to vitamin D, because you're most likely lower, because they are going to be stored more in the fat rather than within your system where it needs to be stored. So let me just go over another portion here, and we're halfway done already, guys. All right, now we'll go for your questions. Now, these are some serious side effects. Lethargic. If you're real tired, I can promise you're getting that spike of your glucose and it's fallen. You get real tired after those large meals. You notice your skin is going to change, as we talked about, and it's not the chocolate so much, it's not the fried components. It's the white flour, it's the empty carbs, it's the simple sugars. Those are the ones to blame. This is found in many different studies out there. We always used to think it was the fried foods. It's not. It's the sugar that's toxic. If you're bloating, you need to drink more water. That will help flush. But you also need to increase your potassium level. That will help reverse sodium to be excreted from the kidneys. A little trick for you. Okay? Your memory and cognitive function will obviously decline. We do notice that those people who have more saturated fats, the bad fats, that has an effect on the brain. Saturated fats will increase the bad cholesterol, the LDLs, as well as triglycerides. So the saturated fats, the bad saturated fats, too much of that, as well as the trans fats, those liquids that's been converted to a solid, your margarines and things like that, certain not natural foods, can increase your low density lipoproteins, which is your heart plaquing, your vessel plaquing arteries, because when it starts to plaque and blocks off blood supply to the heart, we call that a heart attack. To the brain, we call that a stroke. The big one here is constipation. Remember, no fiber. There's very little fiber in those fast foods. All right, it's all refined, it's all processed. When you don't have fiber, your peristalsis is not working correct. When you don't have fiber, which is the prebiotics, they don't feed the probiotics. The probiotics are always hungry, like you're hungry. And if you're not going to feed your probiotics with the prebiotics, which is your good fiber, particularly your soluble fiber, you're going to have gut problems. You're going to have IBS. You're going to have colitis. You're going to have heartburn. You're going to have reflux. You're going to have a whole bunch of different problems. So this is really important. And again, when we talk about obesity, this is a very serious issue. Obesity is linked to diabetes, autoimmune. Obesity is linked to cancer. Obesity is linked to a lot of different problems. And please be serious. Start losing your weight. Your blood pressure will come down. Your bad cholesterol will come down. Your HDLs will come up as you start exercising and walking around more. But this is very, very serious. And I'm really stressing to people out there to really get on your weight now. Don't wait till next January. Do it now. I really mean that. We need to decrease inflammation. Those people who have inflammatory diseases, inflammatory problems, gastritis, bursitis, rheumatoid arthritis, lupus erythematosus, any type of itis or inflammation going on in the body, if you decrease sugars, it will help it tremendously. I do recommend, one of my favorite things is omega-3s, because of the fact we have too much omega-6s. Omega-6s are our whole grains. Too much omega-6s are inflammatory, which can lead to lots of problems. Your teeth decay is another big thing of excessive sugars, drinking those Coke, soda pop, whatever you call it. That is something that's going to suffer. Remember, we're looking at our blood spiking, too much quick blood spiking because lack of fiber is going to cause a burden on the pancreas affecting insulin. It's going to become immune to it. Eventually, the insulin is not going to be able to attach to the receptors in the muscle cells or on the cells that need to get into to be used as ATP within the mitochondria, and therefore it's going to start to becoming more resistant. Okay, so you need to be aware. The key thing is trying to have that fiber to sustain normal glucose and insulin levels that will actually reverse insulin resistance and increase insulin sensitivity. All right, just about done. So the last thing we talk about cholesterol. Cholesterol is important. What's even more important than cholesterol to me is inflammation. When they check your inflammatory markers, those are more dangerous. Remember back in the 80s, I think cholesterol levels were like 350, 360, 370. Now they're 200 total cholesterol. So there's money to be made in pharmaceutical markets. There's a lot of things you can do to lower cholesterol naturally, which will go into another program. But for this sake, my concern is to reduce disease, reduce heart disease, reduce stroke, keep your body healthy, keep your immune system strong, get those probiotics, those fermented foods, your kefirs, your yogurts. Eat those prebiotics, those soluble fibers. You must have that fiber. The fiber will prevent and reverse type 2 diabetes. It can definitely reverse insulin resistance. So I really hope that this information was helpful. I'm sure that you will share it with your friends and family because you'll be helping them. I really appreciate all of you listening. Most important, make it a great day. I'm Dr. Alan Mandell.